Welcome students to another Learning with Lafferty video. Within this video we're going to be talking about the digestive system. So like always, Manee's lurking in the background. Maybe a little of assistance to me today, Manee, but definitely manatees and humans have a little bit of differences in their digestive system. So definitely going to use a diagram demonstration here in a little bit to help you to learn the parts of the digestive system and what it does for us. Obviously it keeps us alive because unless we eat, we will die. So one thing important when you're thinking about the digestive system, I want to point out the fact that this system itself is really considered what they consider outside because it's separated from the body cells by that mucosous membrane that I would have talked about in prior videos. Now, definitely important to understand that this tube, this GI tract that we're going to be looking at, helps to convert the food into components that can cross by that barrier. Okay, so remember the gradient change of, again, diffusion or pumping, the cytosis. Okay, so definitely chapter 3 would help you a lot in most textbooks, which is the cell chapter, definitely towards the end of that chapter of those transporting mechanisms, but also understanding the tissue membranes. Okay, definitely the mucosis, which is an epithelial tissue type of membrane. But it requires both enzymes that we're going to look at, so a lot of chemistry within this chapter, and definitely water. Okay, we're going to be looking at a big component a little bit this week with this video, but in future video that I want to be talking about the urinary system, we're really going to be looking at the water and salt component, okay, itself. Now, definitely think about structure and function, anatomy versus physiology, and how homeostasis works. Okay, so nutrition is something that also we think about. Nutrition, we think about the things we eat, but also goes back to the chemistry, the basic chemistry, okay, but those elements, okay, those ions, things that we consume that our body needs to get from the foods that we eat, and how the body is going to metabolize those components. Now, every body cell within us has to have nutrients, okay? So definitely glucose, would have talked about this in prior videos. Glucose we get through monosaccharides, again, stuff for eating, again, milk sugars and fruit sugars and table sugars, all that converts back to glucose. That will be the fuel that our body is going to need. Now, again, the cells will use that potential energy contained in the nutrients to do the work. So you can see we got to eat, but of course it's got to be broken down small enough, and that will be something you'll see in another video called the metabolism. Okay, so in this video I want to stick to the obviously the basic structure, okay, it's very important, and the basic function, the physiology of it, okay, within this chapter. And I'll have another video that you'll have after this one that will definitely get into, okay, it's in our body, what are the cells going to do and how they're going to metabolize. But we got to see digestive, how is it going to get small enough that it can cross that barrier. Okay, so remember, the size of the molecule is definitely important to always be considering. Now, most things that we eat are too big and too large to enter the cell. So that's why digestive is all about breaking it down. So first we must break down the foods into smaller pieces, components, and that is what true digestion is. So there really is 3 processes when you think about digestion. First, digestion, its name, okay, is important. That's breaking down something large into smaller. Okay, number 2 is going to be the absorbing. Okay, so that's where it's going to cross. Again, it's small enough now, it's in the blood supply, then it's going to cross over into the cell, and that's absorption. Okay, so absorption is the transfer of all those nutrients that were small enough from the GI, the digestive system, into the circulation. And then number 3 is going to be metabolizing. Okay, that's what we're going to be looking at in future chapters, where digestion, absorption, and then eventually, of course, you could add a 4th into that, which is in this chapter too, of elimination. Okay, once the body gets what it needs, it's going to get rid of it. Okay, so I want to focus on, of course, digestion. We'll talk about where the absorption is going to occur to get into the blood supply, and then, of course, elimination in this chapter. But the next video will focus on, okay, what are the cells really are going to really molecular, that cellular level, what are they going to do with that food they have gotten? Okay, okay, at that point. Now, it's important when you're thinking about, and I want to talk about two different groups of the parts, okay, the anatomy, okay, the structure of the GI tract, okay, the gastrointestinal tract, and the parts associated with this almost 30-foot tube. And then with that, accessory organs that are going to help food in the digestive tract. Okay, that is important. Of course, we're going to start in the mouth, and we're going to work all the way down to my most word that I love to use as much as I can throughout an A&P is anus. Okay, so we're going to talk about your mouth to your anus, that tube. Okay, that is a complete tube. Obviously, it's got some different shapes and sizes and names we're going to talk about, and that's where, I'm going to mention them, go through them fairly quickly in this part, and then you're going to see, obviously, you're going to see my little part of the video that's going to give that demonstration that's going to really break down those parts. But it is important to know the moment food hits your mouth, what enzymes, what chemicals that are catalysts breaking down the foods that we eat. Okay, so some of it starts in our mouth, some of it does not start breaking down until it reaches our stomach. Okay, even further past our stomach into the beginning of the small intestine. So we're going to be looking at some of those names. So definitely know the names are going to be important. So the gastrointestinal tract, again, is a solid tube, and it's going to consist of the following: your mouth, your pharynx, aka your throat, esophagus, that's important. Now, the esophagus is going to have these sphincters that we're going to look at, and sphincters are going to be muscles that are going to, again, allow food to continue on and hopefully not allow the food to go backwards. Okay, of course, also with the food comes different acids and enzymes. Now, after your esophagus will be your stomach. There'll be three parts of the stomach we're going to look at, which is the beginning. Okay, the most proximal portion of your stomach is going to be the fundus. The middle would be your body. And then the last part you're going to see is going to be your pylorus. Okay, so your pyloric sphincter would be at the end. It would be the most distal part of your stomach. Now, after the stomach, again, we're still in the GI tract, is going to be your small intestine. Now, in the small intestines are going to be three areas. The most proximal portion of our small intestine has a couple ways you can say it. Okay, I'll pronounce it a couple different ways to help it. Whatever you pick, it doesn't matter. Okay, so according to this textbook, it's duodenum or duodenum. The other way to say that with the duodenum, okay, or duodenum. Okay, duodenum. Okay, whatever you want to say it, I probably will vary it off and on as I'm saying it. Okay, so duodenum or duodenum or duodenum. Okay, whatever way you want to say it, it does not matter to me. But that is the most proximal portion of your small intestine. That one is very important, the D in this one, because that is where most absorption and even digestion to the fullest amount is going to occur. Now, after that is going to be the jejunum. Okay, and after that is going to be the ileum. Okay, so three regions. The ileum would be the most distal portion of your small intestine. Large intestine. Now, the large intestine is the last portion. There's many names associated with the large intestine. Very important to know. It's more than just your colon. Okay, so the proximal, the beginning of your large intestine is going to be the cecum. Then after the cecum, and again, one thing off of the cecum I'll mention here is one of the accessory organs is going to be the appendix. Okay, comes off of the cecum. Then after the cecum, you're going to see, of course, in the demonstration that the poop is going to be forming up the colon. Okay, so colon goes ascending, transverse, descending to the sigmoid colon. Okay, so four parts of your colon. Then after your colon, then you go to the rectum. And then, of course, after the rectum, you're going to have your anal canal, which will have your anus. So definitely know from mouth to anal canal is very important. All the parts along the way of how they are directly connected. Now, the accessory organs assist, okay, with the GI tract. Okay, again, secreting things into that part of your body to help to break down those foods. Now, teeth and tongue, again, in the mouth region, that would be a couple accessory organs. Yes, the food is going to touch those parts. Okay, so your teeth and your tongue. Now, salivary glands are also within your mouth, so you have three things within your mouth that are going to help with that process of digestion. Okay, so salivary glands, there's three of them. So there's the parotid, the submandibular, and the sublingual. Okay, definitely need to know those. Then after that, these are the ones that are not being touched by the food directly. So we have our liver, our gallbladder, and our pancreas. Okay, and I already mentioned the appendix earlier, but technically the appendix would be the other one. Okay, so liver, gallbladder, pancreas, and even the appendix, food does not directly touch those parts. They are secreting liquids or helping with white blood cells to the GI tract, the gastrointestinal tract. Now, one thing important about this digestive system, okay, is the peritoneum. Okay, so the peritoneum is a serous or serosus membrane, also epithelial, that lines the abdominal cavity and also folds back to cover most of the organs contained within this cavity. So definitely when you go back and think about the two different main cavities we have, the dorsals in the back and the ventrals in the front, this is where the peritoneum is very important. Now, the outer portion of this membrane, the layer in contact with the body wall, okay, is the parietal. Okay, you would have seen this in last video when I talked about the difference between a parietal and a viscera. Okay, so the parietal covers that cavity, okay, that holds this part, but also you have a viscera that covers the outsides of the organ. Okay, that's going to help, of course, blood supply and, of course, nerves to get into and innervate these parts in this system. So there are some subdivisions, some names that you're going to see within the peritoneum, okay, around various organs that have special names. So the first one is the mesenteric. Okay, so the mesenteric is a double layer portion of the peritoneum. Okay, that's kind of shaped almost like a fan when you kind of look at it. The handle portion is attached to the posterior, so the back part of our abdominal wall, and the long edges of it is attached to the small intestine. So remember, when you think about these membranes, not only do they provide protection and layers of tissue, they also are helping to keep things in place. That is important. Now, between the two membranes, okay, layers of the mesenteric are different vessels and nerves that will give life to the intestine. Okay, very, very important. Now, the section of the peritoneum that extends from the colon, so large intestine, to the posterior abdominal wall is the mesocolon. Hence its name. Okay, that's kind of the easy one. So mesenteric, small intestine. We think of mesocolon. Colon would be large intestine. Okay, again, kind of holding it in place also too. Now, there also is a greater and lesser omentum. Okay, so these are parts of the peritoneum. Again, a large double layer of the peritoneum that covers almost like fat kind of hanging down like an apron, okay, on the front of the intestines. So the greater omentum is going to extend from the lower portion of the stomach into the abdominal cavity or the pelvic cavity, and then loops back to the transverse colon. So it's between, again, the large intestine and the stomach itself. And then the lesser omentum, okay, the smaller of the two, is going to extend from the stomach to the liver. Okay, so kind of think everything's kind of tight in here, and that's why in the demonstration you're going to see those parts and all. So when you're thinking about layers, I would start on the outside and work my way in, okay, because we just talked about the peritoneum, and the peritoneum is that serosus or serous membrane, okay, that coats, again, the outside of the digestive tract. Okay, so that very thick double wall, and remember, kind of splits off in different directions to hold the various organs of the digestive system in place. As you're heading from superficial to deep, the next one would be the muscle layer. Okay, that's a very important layer that you definitely need to know. Okay, so serous, okay, serosa, to the muscular externia, which is where the muscle is found. And we'll talk about that one here a little bit more in detail here in a second. The next layer, getting more deeper, is going to be the submucosis, connective tissue. And the very deepest layer, the most internal layer, is the mucosa. Okay, that's going to have mucus, okay, that's being secreted into the tube. That's where the food is going to touch. So again, deepest, mucosa, submucosa, muscularis, okay, muscle, and then the serosa or serosa type of membrane. Now, within that muscle layer, you're going to find an action called peristalsis. Now, because it has various muscles that run different directions, this is where you're going to find that it's going to constantly push the food that's in the deeper layers below it slowly through the digestive system. So literally starting at your throat, going all the way down, even through your stomach and your intestines, that's that constant peristaltic, peristalsis action. It is going to be a movement like a wave that being caused by the circular muscle that contracts and propels food throughout the digestive system. So of course we're going to see that's also going to help to mix all these juices, these enzymes that we're going to be talking about. Now the different regions of the digestive tract will use these different forms of mobility and help the nerves themselves from the autonomic nervous system are going to help to push the food from mouth to anus. That's very, very important. So this is a great overview of what the digestive system looks like. Obviously not to scale. So food is going to start in the mouth. Teeth and your tongue are going to help to break down the foods. But that's where we're going to find the salivary glands, the parotid, the sublingual, and the submandibular that are going to secrete enzymes in your mouth. Then food travels to your pharynx, down the esophagus, into the fundus of your stomach, into the body of your stomach, and into the pylorus of your stomach. From your stomach, food then moves into the small intestine. The beginning portion is going to be your duodenum, your jejunum, and lastly, the ileum. The ileum then directly connects to your large intestine, and food moves into the cecum. It has the appendix that comes off of it. Up your colon, ascending, transverse colon, descending colon, sigmoid colon, to the rectum, into the anal canal, and out your anus. Now one thing I want to point out when we go back to the small intestine is the liver, the gallbladder, and the pancreas. All three directly, also along with the pylorus connection, connect directly to your duodenum of your small intestine. So definitely know how the food travels through your body. So let's look at the parts and talk about them. The first one is going to be your mouth. Your mouth is also called your oral cavity. And it's going to have the following digestive functions. Of course, it receives the food. That is the word of ingestion. Then it breaks down the food. We know that's mostly done by your teeth. You can use your tongue somewhat with that. And that's that word of mastification. Now the next thing you'll see is the food is going to mix with the solution called saliva. And we'll get to the salivary glands here in a minute. But saliva is produced by your salivary glands. And that's going to help to break down some of the foods. And then lastly, it controls the amount of food pushed towards the throat that will be swallowed through a process called deglutition. Now also within our mouth we'll find our tongue. Again, that muscle organ, which is crazy to think that your tongue is a muscle, but it is, that projects the food again, and it's going to make the food. And actually your tongue is almost like a cat in your mouth, is always curious of what's in there. If like you have a place in your tooth, like a rough spot, it's going to actually fill it. But the tongue itself is going to help to form the food into what they call a bolus. And a bolus just is going to help to get that food small enough to get into the tube of your esophagus to get down to your stomach. Now teeth, I'm not going to talk a lot about teeth because what I'm teaching is not a dental class by any means, but obviously knowing that there are different types of teeth in your mouth would be important to know, and a little bit about the teeth. We know baby teeth, obviously with baby teeth we know after a certain amount of time, so that's our first set of teeth. 20 is usually about the general normal number. Then their adult teeth come after that, and we usually have one complete set of the adult teeth, which is usually about 32. Now again, we have incisors, we have premolars, we have molars. Cusp as they're called. Again, the cusp would be the little indentation inside of that area. Now, the main substance, as far as what a tooth is made of, is dentin. Okay, it's that calcified substance, harder than bone. Okay, but of course, these are still bone when we kind of think about, especially when you're thinking at pulling out a tooth or pulling it out of the joint. And again, a joint is an articulation, two parts meeting. Now, when you think about the extra coating on top of that, is the strongest, hardest substance in the body called enamel. That is important, okay? Anytime you have the most or the littlest, this is the most, and the hardest substance within your body, harder than bone, is going to be enamel covering the crown of our tooth. Okay, again, the crown's the part you see, hence if you ever have a crown. And then, of course, we think of the gum line. Okay, and then you get farther past that would be the root. Okay, that's, of course, where the blood and nerves would actually be. Now, I want to talk about the salivary glands, okay, and the importance of your salivary glands when we're talking about the mouth. Now, the salivary glands themselves, there are three of them. You're going to have your parotid, which is the largest. Number two is your submandibular, okay, below your mandible. And then sublingual below the tongue. Okay, so of those three, the parotid is the one that we think about conditions such as mumps. It is the largest of them. And you produce about a liter, which is a lot of liquid within your mouth. And the purpose of saliva is twofold. First, it's going to help to break down the foods, okay? It has a special enzyme called amylase. And amylase helps to break down carbohydrates, okay? Sugars, okay? And that digestive process starts in your mouth with carbohydrates. The second process that happens with salivary glands is that saliva is going to help to break down bacteria within your mouth. So it's a little bit of defense and a little bit of digestion, okay, that your salivary glands are going to do through the producing of saliva. That you're going to find your pharynx, aka your throat. Now, definitely remember, if you've forgotten already about the respiratory system, that the pharynx was located there also. Know the parts. So nasopharynx is behind your nose, okay, oro in this particular region, pharynx. And then right below that would be where, of course, within the respiratory system, we talked about the vocal cords, which is the larynx region. But the job of the pharynx here is to get it into the esophagus. Okay, and the esophagus is the next portion, and that is located more posterior within our body. So trachea would be in the front. Okay, remember kind of with that it was a C shape, and then the esophagus fit somewhat, a little bit inside of it, except when we eat something too big, it can go in the trachea a little bit more. Now, it's just a food tube, okay, to kind of help you remember it. I know that sounds kind of bad, but it's a muscular tube about 10 inches long. And again, this is the one that has the voluntary striated muscles in the upper portion, so the proximal portion of it. So we can obviously control that portion of it. But then the rest of it changes into smooth muscle when we get down to the middle and the distal end, the bottom of your esophagus. The most proximal portion of your esophagus has a sphincter that's going to help food from getting into your trachea somewhat, okay? And it's also going to help prevent too much air from getting into your stomach. And then the most distal portion, okay, the lower portion of your esophagus is going to have a sphincter that's going to help prevent, hopefully, most of the time it works well, that stomach acid from coming out of your stomach. Okay, so that lower esophageal sphincter is the one that we worry about with conditions such as GERD, okay, heartburn. Now we're going to look at the following parts as food moves down into the body. Food is going to start in the mouth, then move to the pharynx. Now after the mouth and the pharynx, we're going to move on to now we're going to talk about the esophagus. And the esophagus is your food tube, so it's going to bring food from your mouth and pharynx down to your stomach. At the top of it, it's going to have a sphincter, and at the bottom of it, it's going to have a sphincter. And the lower sphincter is what's directly going to connect to your stomach. Now, the distal portion of your esophagus is attached to the proximal portion of your stomach. And let's talk about the three names of the stomach again. We have fundus, that's the proximal, the beginning, the body, the middle, and the pylorus. Okay, that's going to have a sphincter there. So the beginning of your stomach, the fundus, the proximal portion attaches to the lower portion, the distal portion of your esophagus. And of course we have the body that has the curves in it. And then lastly, the last portion of your stomach is going to be your pylorus. That's going to have a sphincter. That's going to, the distal portion of the stomach attaches then to your small intestine. Now, again, some functions of your stomach are going to regulate how quickly that it empties. So it's about 3 to 4 hours once food gets in it that it's going to take, that it's going to be like a washing machine. It's going to toss things around, and it's going to secrete liquid. Okay, hydrochloric acid itself is the name, which is 0 on the pH scale. And of course other juices to help break down foods. Well, chyme is going to be the name you're going to see when we think about that hydrochloric acid in food and all those other juices and enzymes mixing together. There are some hormones associated also with your stomach. Now, pepsin is one of the enzymes, and that's going to help to break down proteins. Okay, so these proteases, as they're also called, are going to be special enzymes that help the process of proteins unwinding within your stomach. So again, making something larger into something smaller that the cells eventually can get. Now, there's also mucus, and remember, one thing I did not mention earlier is important to remember that this is a tube that has mucus running all the way through it internally. Okay, hence that layer of the mucosa layer. Okay, constantly secreting to help to lubricate, but also to kind of let things slide out of the body also. So also we have a little bit of absorption. Again, absorption is getting it into the blood supply. So it has to be small enough to cross over that membrane, okay, to get into our blood supply, the blood vessels. Now, after we have the pylorus, okay, it's going to slow things down from entering the small intestine. That's the distal portion. We have the most proximal portion, which is going to be your duodenum. Now, the stomach has 3 names associated with it. The proximal portion of our stomach is the fundus. The fundus is connected to your esophagus. So after the esophagus, we go from fundus. The middle of our stomach is the body. And the last portion of our stomach is the pylorus. The pylorus has a sphincter that will directly connect to our duodenum. The duodenum is the small intestine. So the pylorus connects directly to the duodenum. Now, the next portion is going to be our small intestine. Okay, that is important. So pylorus connects up to your small intestine. The most proximal portion of your small intestine is the duodenum, the jejunum, and the ileum. So know those 3 portions: proximal, middle, and distal. Now, the duodenum is going to be the area that you're going to find most of the digestion and the absorption, especially into the blood supply, because this is where you're going to find the capillary beds. And everything we've talked about to this point goes back to the capillaries. And the capillaries are all about exchanging things from blood tissues. Blood tissues. And again, tissues is a group of cells, if you don't forget that will help you. Okay, so from blood to cell is at the capillary beds. So within your small intestine, that beginning portion, a little bit of the middle portion, you will find these things called villas, microvillas, or also better known as the brush border. So as food goes by, those little fingers, almost like the cilium that we would have talked about, the cells, those projections that come off the plasma membrane, instead of like moving stuff along, things are sucked into the small intestine. And that is where it's going to allow it to get to the capillary beds. Now, one thing about capillary beds, and don't forget, we talked about this in previous videos, of the lymphatic system. So this is where you're going to find the lacteals, and the lacteals' job is to help to break down those big, giant fat molecules. That's important. So the lacteals are located within the small intestine. The microvilla, the brush border, is inside of the small intestine. So as food goes by, it's sucking it into the blood supply because there's capillaries that are located there. So what's absorbed? So simple sugars, glucose, some small of those peptides, so small proteins, amino acids, of course those are the little building blocks, a little bit of fatty acid, some of these nucleotide acids, water-soluble vitamins, and most of the water in the digestive tract absorbed into these capillaries at this particular area. So you think about most of the nutrients are being absorbed within the beginning to middle portion of the small intestine. But the fats and the fat-soluble vitamins have to be absorbed in the capillaries, yes, but then remember they take another bypass and go into the lymphatic system, so that the liver eventually is going to play a role into helping to digest and break down those fats. All of this that connects to our stomach, this tube that is almost 20 foot in length, is going to be your small intestine. Duodenum is the proximal beginning of your small intestine that attaches to the distal end of your stomach, and that is called the pylorus. So the pylorus directly connects to the duodenum, and also some other things that attach to your duodenum we'll look at here will be your liver, your gallbladder, and your pancreas. We'll look at those here in a few minutes. So distal end of stomach, pylorus, proximal portion of your small intestine, your duodenum. Now the middle section of your small intestine is called the jejunum, is the middle portion of your small intestine, and then it connects up to the ileum. And the ileum is the most distal end of your small intestine, and there is a valve, aka a sphincter, that slows down movement from the small intestine into the large intestine. Now let's look at the ileum connecting to the large intestine. Now the next portion is going to be the large intestine. So the ileum has a valve that slows things down from going to the proximal portion of the cecum of your large intestine. So when you think about the difference between small intestine and large intestine, about 20 feet as far as length is your small intestine, and about 5 feet of it is going to be large intestine. Okay, so but the diameter is much bigger, obviously, in the large intestine than it is in the small intestine. Now the subdivisions for the large intestine, again, beginning proximal portion is the cecum. Okay, that is the lower right region of the abdomen. It's like a little pouch, and within that pouch you're also going to find the appendix. And then moving upwards is where we have our colon. So ascending, transverses across, colon, descending, colon, back towards the middle, which is the sigmoid colon, and then empties into the rectum. Kind of a temporary storage area, as it's called, for anything that's indigestible or non-absorbable food. And then the very narrow terminal end, okay, distal end of the small intestine, and that's where you find the anal canal, and then from that, everything leaves the body through the anus. Now, what's the job of the small intestine? We think, of course, secretions and absorption and digestion. The large intestine, on the other hand, is about little bit of absorption, but it's the change between water and salt. Now, one thing that's important to always understand, where we have salt, water is chasing it. Okay, so we have lots of salt, guess what? We're going to have lots of water. We have a little bit of salt, we have a little bit of water. So think about keeping salt in your body, in your large intestine. What it does is to your feces, aka your stool. Okay, so too much water in my stool, obviously diarrhea. Not enough water in my stool, we think of constipation. So that's where that homeostasis as far as salt and water occurs within this system mostly. Now we think about, we also have, of course, voluntary and involuntary muscles along the route here. So we think about the ones we can't control, but we can, are relating back to those sphincters, okay, of me pushing out the feces, defecating, okay, comes from voluntary. We can control it for the most part, but you get to a certain point, and if it's too liquidy, obviously that sphincter is going to open anyway. Now this is an area we find our GI system. We think about the good gut health, because within this system, the food that remains, okay, unless we're massively pushing it out, bacteria normally lives within the colon and acts to produce vitamin K and some of the vitamin B complex vitamins. Now these vitamins are absorbed by the mucosa within the large intestine, And then that, of course, we think about if we get antibiotics, if we destroy the good guys, then the bad guys can grow back much quicker. So it's important to think about when we have antibiotics, not only we're killing good bacteria, but we're also killing bad bacteria. And if you kill them all, that can lead to the bad guys overrunning the good guys when everybody starts to come back. The distal end of your small intestine connects up to your large intestine. Now, the large intestine has many names. The most proximal beginning portion of our large intestine is the cecum. Now, coming off of the cecum is our appendix. Our appendix is going to hold some white blood cells to help kill bacteria or viruses that could be in our large intestine. Up your colon, ascending, transverse colon, descending colon, sigmoid colon, to the rectum, into the anal canal, and out your anus. Now, the other types of accessory organs, when we think about the digestive system, are going to be liver, gallbladder, and pancreas. So let's talk about what the liver is and what it does. Now, the liver is referred to as hepatic. Okay, so if you think hepatitis, it's directly affecting your liver. But the HEPA is referring to liver. Okay, so we have the hepatic portal system, these veins, okay, associated with the small intestine, large intestine, and spleen. In prior chapter videos, I would have talked about that circulatory, okay, of the blood itself. The liver's main digestive function is to manufacture and produce a substance called bile. Now, bile is something that's needed in the process of emulsification. Now, because of the nature of how fat is, it will gather into little droplets, and the salts contained within the bile is going to act as an emulsifier of that fat. It breaks up the fat into smaller droplets that can be acted on more effectively by the digestive enzymes. So a larger molecule to little tiny smaller molecules. Now, bile also prevents the products of fat digestion from forming droplets, thus aiding in the absorption from the small intestine. So it's very important. Bile is needed. So bile is secreted into your small intestine from your liver, making it, but it's held and concentrated in the second type of accessory organ called the gallbladder. So the liver makes bile. It also helps to control our blood glucose level, okay, because that feedback loop of helping with hormones. It stores fat, iron, and some vitamins. It helps in the formation of blood proteins. It helps to break down and recycle old, worn out red blood cells or any death of a red blood cell. The byproduct of that is called bilirubin, and it takes the bilirubin and eliminates it in the bile and gives that stool color, kind of that darker color. It also helps with urea, and where urea I'll talk more about in the urinary chapter, but urea is the waste byproduct of any proteins we eat and metabolize. It's released into the blood and then transported to the kidneys via the liver and elimination from the body. And then detoxification is the biggest thing when we think about the liver. But the liver has, about 600 jobs literally that it actually does. But the two main ones would be making bile and detoxification. So the bile is going to leave the liver by two ducts. One called the common hepatic duct. That duct then joins with the cystic duct that's connected to the gallbladder. And then that forms the common bile duct. Okay, of course, the pancreas is going to connect up to that also. Now, the gallbladder itself, as far as its job, it's a concentrator. So that's hence why you can live without your gallbladder. Now, although the liver can manufacture the bile on a constant basis, the body needs it only a few times a day. So the job of the gallbladder is to help to relieve the liver from working too much, so it can do those other jobs. So when chyme leaves the stomach and goes into the small intestine, that's where we're going to find the connection of that duct system, the binary tree system. Now that is going to connect your liver, your gallbladder, and your pancreas to your small intestine. So from this duct system and the bile being secreted will only happen when there's fat detected within that small intestine. That's going to send the message then to the gallbladder through a hormone, CCK. That then is going to cause a release of the bile into the small intestine to help to break down the fats. Now the last of our organs is going to be the pancreas. So the pancreas is located behind the stomach. It's a very long gland that extends from the small intestine to the spleen. It produces enzymes that digest fat, proteins, carbohydrates, nucleic acids. So pretty much everything we eat, the pancreas has a digestive side of it. Now I would have talked about the insulin and glucagon in previous videos. That's the portion of the pancreas that helps to directly control the concentration of glucose within our blood. Now this portion, digestive juices, help to break down our foods. Everything we eat, the pancreas must secrete an enzyme to help to break it down. The digestion, the absorption occurs in the small intestine mostly, so that's why there's a direct connection with the pancreas through that duct system. This is where you're going to find that bicarbonate. Okay, I would have talked about the bicarbonate and the respiratory. So this bicarbonate, sodium bicarbonate, it's an alkaline base, basic fluid, is going to neutralize the acidity of the chyme that's coming in to the small intestine from the stomach and helps to protect that GI lining. So again, the pancreas is unique because it functions not only in the endocrine system, but also functions in the digestive system, releasing its enzymes. Now there are three main accessory organs that directly connect to your duodenum: the liver, the gallbladder, and your pancreas. So this is the stomach. After the stomach, food's going to exit through the pyloric sphincter to enter into the beginning of your small intestine, the duodenum. Now the liver will make bile and secrete that bile into the gallbladder, and the gallbladder is going to hold the bile and concentrate it when it is needed. Now the pancreas also has a duct that connects up to the duodenum. So these three accessory organs all secrete their liquids, their enzymes, directly into the small intestine to break down foods. So liver is going to secrete liquids that help to break down. The bile is going to break down fats. Gallbladder helps to release that bile when needed. And the pancreas is going to make digestive enzymes that also help to break down foods. So pancreas, gallbladder, liver are directly connected to the duodenum. So you're going to find bile in this part and digestive enzymes in this part. But all three of these have one duct system that directly connects to your duodenum. Now definitely go through and look at the different types of enzymes and understand what is coming from where, such as in your mouth you have the salivary glands secreting saliva. That's going to convert, we think of starches, okay, again polysaccharides all the way down to disaccharides. From the stomach we're getting hydrochloric acid that helps to break down these pet proteases that help to break down proteins. Then your liver, of course, is going to emulsify and break down fats. Your pancreas breaks down everything. So it's going to have amylase that help to break down carbohydrates. You're going to have proteases that help to break down proteins. And you also have lipase, which is going to help to break down lipids, aka fats. Now there are some enzymes that come also inside of your small intestine. Those are the ones that are going to help to break down proteins from, again, the whole picture. Individual pieces would be the amino acids, so from proteins to amino acids. And it also helps to digest disaccharides, so such as table sugars, milk sugars, back to monosaccharides. That's where you're going to find those enzymes within that brush border as the food is getting to the capillary bed. So any carbohydrates we eat are going to be broken down by amylase. Okay, amylase breaks down the disaccharides. Okay, the disaccharides then turn into monosaccharides, which are absorbed at the villi within your small intestine. Then your proteins are going to be broken down by your proteases and also these peptides. And that changes a protein into amino acids and digested and absorbed at the villi. And then fats, aka lipids, that are not soluble in water need to be emulsified through the use of bile. Also, liposades are also going to assist in that process. So then the things can be absorbed into the lacteals, which are still at the villi. Now, one thing to know about the digestive system, of course, I mentioned it earlier, that direct connection with the autonomic nervous system. It's called the ENS. This is a parasympathetic control. So a parasympathetic, P for peace, okay, stimulation will increase the activity, gets us back to normal homeostasis of how digestion should work. But sympathetic, S for stress, control, more control, will decrease the activity. So that's why we have this up and down kind of roller coaster ride when we're stressed out of our digestive system. Now, hormonally, we have some hormones. Gastrin is one that's going to stimulate the stomach to have this activity. So if you have food in your mouth, that's actually going to help stimulate your stomach while you get that gurgling sound. And of course, once it gets to your stomach, we have also these gastric GIP, as it's called, so this gastric inhibitory peptide, that when we have glucose in our small intestine, it tells our stomach to slow down. It's got enough glucose right now, but it also can stimulate the release of insulin. Now, secretin is another hormone that when we have acid in our small intestine, that is going to stimulate the pancreas to release bicarbonate, which will also slow down the stomach movement. And then lastly, I mentioned about the CCK. That's the one if you have fat or even proteins in your duodenum. That's going to cause the pancreas then to secrete its secretions to help break down the fats in the foods. But also it helps to slow down the stomach. So we really have about 3 hormones at least that are going to help to inhibit the stomach, but again, a few of them that are going to tell the stomach you need to work a little bit faster. Now, we do have some regulation when we think about the hypothalamus of whether we're hungry or we're not hungry, okay, whether I need to eat or I don't need to eat. Ghrelin is the name of a hormone that's released that stimulates that you're hungry, and that is going to be triggered from the hypothalamus. So if your stomach is empty, that causes that hormone to be released, that stimulates you to be hungry and stimulates you to want to eat. But CCK, insulin being released, and even high levels of glucose should inhibit our hungry and tell us to stop to eat. So it's that homeostasis, that feedback loop that is directly controlled between the hypothalamus and its direct control of hormonal releases and how much we want to eat or do not want to eat. Now, that's kind of the short term with that one. Leptin is the one that is going to be L for L, long term. So we have fat that's stored in our body. The leptin levels are going to increase. That should reduce also our hunger, which affects the hypothalamus. And then that should also reduce our food intake. So again, a couple hormones there that are important to understand, that it all does go back to directly telling the hypothalamus to tell me whether to eat or not eat. The parts that would be directly affected outside of the hypothalamus would be your stomach and your small intestine. Now, when you think about the areas that you just saw within the demonstration, think about disorders that could directly affect them. So when we think about, infections and cancers and ulcers and any type of abnormalness, the first one I'm going to talk about is that membrane. Okay, the inflammation of the peritoneum, peritonitis. Okay, so peritonitis is any inflammation, kind of the generic term of any portion of that membrane coating. Now, the mouth, we definitely think about conditions such as, cavities, the caries, which are cavities. And then we think about, of course, gingivitis affecting the gum, and periodontal disease, okay, thrush that would affect even the tongue. But also in this area, be thinking about your salivary glands, which are going to be parotid, and that parotid gland, the parotid salivary gland, could be affected by a virus, and that would be mumps. Now, in the esophagus and stomach, esophagus, definitely thinking about hernias. Okay, think about gastric reflux that could be occurring, heartburn, better known as the severe chronic condition of GERD. Think about nausea and vomiting. Okay, that would be, of course, a brain telling your stomach it needs to empty. And then, of course, you can also get stenosis, is hardening and a lack of movement or over movement of those sphincters. Now, intestinatory, they kind of break up the intestines into inflammatory would be the first one. So any itises, verticulitis, which would be directly affecting the colon, okay, as far as being more common within the colon. And again, we have a diet that is low in fiber, can contribute to these large numbers of little pouches within the walls of the intestines. Of course, diarrhea, constipation, I already mentioned that earlier, but think about the salts, especially the direct connection with that water and salt connection. Now, besides inflammation and little pockets, you definitely think about anything that's obstructing it. Okay, so this is where you get into, of course, even things like hemorrhoids. Okay, now hemorrhoids is truly a varicose vein of the rectum. Okay, we don't talk about it like that sometimes, but that enlarged vein may cause pain and bleeding, but also could go further up into the rectum and could be an obstruction, okay, of things exiting, eliminated from our body. Now you think of cancers, that, of course, that could affect any portion. Again, cancer is when a good cell has gone bad. Some type of mutation is taken over that healthy cell. Now when you think about liver and these accessory organs, definitely think about liver when you think of cirrhosis of the liver. Directly affects the hepatic portion of our body. So any of the hepatitis is A, B, C, D, E. Okay, there's a whole alphabet, it seems like, of hepatitis is directly affecting the liver. Now, within your gallbladder, you can get gallstones, hence why it's, listed under the obstructive type of disorders. These are very similar to, we think of kidney stones, okay? They're coming a lot of times from calcium salts. So too much calcium can add to kidney stones, and it can add to gallbladder stones. Now, pancreatic disorders, we think, of course, the itises, okay, and any type of pancreatitis is going to affect a lot of times those enzymes being released. But then, of course, on the other side of it, you would think about conditions such as pancreatic cancer. And I'll definitely mention about pancreatic cancer, my direct connection. I lost my father in 2002 to pancreatic cancer. Some symptoms to definitely look for when you think about any cancer, but especially knowing firsthand with pancreatic, is he was having a lot of severe low back pain, enough to make him hunch over. We're not talking about, you pulled a muscle type of back pain. We're talking about severe back pain. He was having a lot of heartburn, digestive problems, a lot of, non-consistency with the stool, such as sometimes would have severe constipation, other times would have severe diarrhea. He ended up finally, after several months, getting a PET scan. And in the PET scan, they had found that the tumor was about the size of a grapefruit. He was in stage 4 pancreatic cancer. He was lucky enough to actually go, and of course there wasn't a lot, and unfortunately still isn't a lot of options in stage 4 for pancreatic cancer, to go to the National Institution of Health in Bethesda, Maryland. There he went through some clinical trials, and actually some of that stuff is actually being used today to help pancreatic patients. They ended up actually shrinking the tumor, killing it at that time, was going to do surgery, and unfortunately it had spread to his liver. And of course we know how important the liver is. Now once that tumor had developed also, he had to take ground up pork pancreas enzymes, because we talked about that enzyme side of the digestive with the pancreas to help to break down the foods that he ate. So with that clinical trial of it spreading to his liver, he had unfortunately come out of it. He was originally given 3 months to live. He ended up living about 16 months. Not so much quality as it was quantity, but did get to spend a little bit more time with my dad. I definitely can tell you it is a very fast moving, very hard to detect There is not a lot unless you get the higher scans to actually see it. There's no preventive testing. They've come up with a few ideals, and there's even the option now that with research of actually coming up with some type of vaccination, hopefully in the near future, to help prevent the cancer before it even begins. So hopefully within this demonstration, in this video, I have helped you to see the various ways that our digestive system literally keeps us alive. Now, kind of random facts about you, Mr. Manee, is that you eat anywhere from 100 to 200 pounds of grass seeds every day. So I highly recommend, of course, you kind of look at the weight of these sea cows, hence why they're called a sea cow, of how much they eat. I do not recommend that you eat anywhere from 10 to 15% of your body weight every day, but we kind of do when we kind of think of it in some ways. But they eat anywhere from 6 to 7 hours a day, okay? Which you kind of think about if we take a couple hours here and there. So definitely, manatees have a little bit of differences, obviously, when we think about eating. They definitely, just like they're a herbivore, okay? So they're eating the plants, so they're a true, I guess you would say, vegan in some ways, where a lot of us are not. But definitely important to understand when we are thinking about digestion, we have to have all of the different type of foods, carbohydrates, lipids, and proteins to get all the pieces that we need to make up this body that we have. I look forward to seeing you all within the next video.